Good morning. Thank you for joining us this morning. I am Arlen Visser, one of the senior health specialists with Arch Veteran Company. Before we get started, we have everyone muted, and at this anytime you can type in your questions on the right. We will address them during and also at the end. I'd like to introduce Courtney Stowe. She's a broker manager with Humana for Illinois, South Dakota, Nebraska, and Iowa. We're going to learn about the veterans healthcare and how it works with the Humana Medicare program. So go ahead, Courtney, and take it away.
Thank you so much for having me here with you all. So as Arlen mentioned, I'm Courtney Stowe, and I've been with Humana for about 10 years now, coming up on 10 years this summer. And I was an agent myself. I remember feeling like I didn't ever want to do anything wrong when it came to helping our veteran population. I always felt like if they said, yes, I am a veteran, that I didn't know what to ask next to understand the full scope of what I could do to help them. So with that being said, that's what this presentation is about. I hope my goal for this is for you to come away from this thinking that you really do feel comfortable talking to Medicare beneficiaries and that our veteran clients, and you know what to do when they say, yes, they are a veteran, whether it's that they have VA benefits alone, Tricare for Life, or CHAMP VA. So those are the three topics we're going to talk about. Before I get into that, sorry, my slides I keep clicking the buttons, so that's on me. I want to let you know that I didn't come up with this presentation myself. We have an entire team of experts that are here to, one, they are veterans or the spouse or parent of a veteran. They have deep ties to the veteran population and communities. And so these are the people that put together this presentation and have educated me on this topic, because I myself am not a veteran, but this group are the ones that are our go-tos anytime we need help. And if you ever have a question, we have a team backing us up. So this is a quote that I really love that they put in here. A country that creates veterans should be prepared to care for them. And that can take many forms, and we'll talk about them at length. But this is such a profound opportunity for agents to give back to those who have served us. So that's why we put this quote up front. I want to present this from a service mindset of how we are supporting our veteran population. And if I had a nickel for every time I said veteran during this presentation, I'd have a lot of nickels on the side. Something else prior to talking about the details of VA healthcare, I want to let you know that this isn't something that we are just doing to try to sell. Of course, we have plans geared towards our veteran population, but we also are heavily invested in several different veteran organizations. You can see a number of them listed on the screen. Rolling Thunder changed its name to Rolling to Remember. That's a motorcycle event in Washington, D.C. But many of these you all are probably very familiar with and have heard of before. We're the national exclusive partner with the DAV and VFW. You can see on our sales kits, we are endorsed by the USAA. So I say that not because I'm looking for a pat on the back, but because I want you all to know that we are really invested in not just selling to veterans, but also serving and educating our veterans. So here's what we're going to cover today. At every meeting that you have with a member, we hope that you feel comfortable asking, are you a veteran? You're probably going to get a lot more yes answers than you would think if you're not asking. And a lot of times people don't offer that information right up front. We're going to talk about VA healthcare and how that works with Medicare, or more importantly, it really doesn't. And we're going to spend the bulk of our time talking about specifically VA healthcare, because that is what you'll find most people have. Now, I do get a lot of questions about Tricare for Life and CHAMP VA. We absolutely will talk about those. So just if you have questions specific to Tricare for Life or CHAMP VA, hang on to those if you can until we get to that section. But we will spend the bulk of our time on VA healthcare. You will bump into that much more frequently than you will Tricare for Life. So asking, are you a veteran? This is a sticker I actually had on my laptop for a long time because it isn't necessarily something you always remember to say. It's in all of the applications usually it'll prompt you to ask, but definitely a fantastic warm-up. It should be part of a thorough needs analysis. And you can see the word needs on the screen is in all caps. That stands for what do you have now? So N is for now. What do you enjoy about that coverage? So what do you like about what you have today? Helps you understand, what they're looking for. What would you add or adjust? What do you not like? Are you the decision maker? So decision. So if they have a power of attorney, and then summarize so that they're confident that you heard what they said. So this is a really fantastic way to get to know your veteran. You can connect with them on a deeper level. You can ask more questions about their service. I was always afraid to ask more questions about someone's service. I didn't know what questions to ask, so we've given you those. And what is one of the things that I guess I didn't realize, and I'm coming at this from a very uneducated space when I started. I didn't know very much about the military when I started. People have tons of different jobs when they are in the military. It's not necessarily all what you would think. There are several different ways to serve in the military that aren't necessarily the most visible or combat. So asking, what branch were you in? What did you do for that branch? Where were you stationed if you were deployed, or that kind of thing? Those are some follow-up questions, and usually people are really happy to share that information. This is an area, this last point, that I think agents can be really helpful. Something I have found in my time as an agent, that I had some veterans that were kind of isolated, or alone by themselves, didn't have a lot of people around them in their life. Helping make sure they know about and are connected with some of these organizations like the American Legions, the VFWs, the AMVETs, that they can be part of, so that they're not experiencing social isolation, because that can be a real problem, and helps contribute to some of those problems that we have with mental health for our veteran population. So we'll talk more about that as we go along. It's important to ask the question, because of course you're showing them that you care about them, that you want to get to know them. It's really fantastic for asking for referrals. A lot of times veterans are friends with other veterans, or are part of these organizations. So if you do the right thing for them, they'll trust you more to do the right thing for others. You can possibly do different marketing things. We have a Medicare 101 tailored for veterans that you can deliver at these American Legions or AMVETs, or wherever will let you come in to do those community events to educate. So we have people doing those all over the place. Really cool way to engage and educate. But we need to know too, Humana needs to know that information. It really helps us design products, and we'll talk about our product designs for the honor space. It helps us know who might need more help too. If somebody identifies himself as a veteran, it may help us reach out to them in a different way. And kind of lastly, and this is not on the slide, but it will identify them in your Vantage portal as a veteran. So if you send Veterans Day cards, you'll be able to sort your book of business by who is a veteran, so that you can remember to do that. And you already are able to pull their information out so that you can do that. I apologize, I keep getting emails. If you can hear that on your end, I'm trying to shut that noise off, but I'm not being successful. Okay. Next, let's talk about the opportunity. So this is there's a lot of veterans out there. 9 million of the veteran population are 65 and older. So this is a very, very common thing. About 20% of the people that you meet with are a veteran. So it's not a rarity at all. It's going to be extremely common. And you'll find that there is varying degrees of understanding of their options. Some people do take Part B, some people don't. Some people have no idea what they should do when they turn 65. Some people do. And that's just the place that you all as agents can make the most tremendous impact, is making sure they understand their choices. So VA healthcare first. We're going to go into that first. I'm going to explain all three different types, and then we'll break them out one by one. So firstly, VA benefits. This is for somebody who has served. So they are a veteran, they're reservist, National Guard. There are qualifiers to getting VA healthcare. So just because you are in the military doesn't mean that you are automatically going to have access to VA benefits. So we will absolutely talk about that. People who have VA healthcare get their care at specified VA healthcare facilities. So I'll talk about VA healthcare facilities and civilian doctors. Civilian doctors are where I go. That's where most of the population goes. That's the regular doctors and hospitals that are all over the place. Civilian, that's what I mean when I say civilian. VA healthcare facilities are separated, and that's where they have to go to receive their treatment. Some spots have tons of those places, some spots don't. Like, for example, where I live, the closest VA hospital is a good 45-minute drive. So if somebody only has VA benefits, they don't take Part B, they're going to have to travel quite a bit, and that may or may not be a reasonable thing for them to do. Next, I want to talk about CHAMP VA a little bit, just to identify what it is. So this is for the spouse of a veteran. So CHAMP VA is not for the actual veteran themselves, it's for their spouse. If the spouse was deemed 100% disabled by the VA or who died as a result of their service. Now, I do have a personal story here. My mother-in-law has CHAMP VA because my husband's father passed from Agent Orange related complications. So she now has CHAMP VA, and I'll share more about that experience with you all as we go along. But again, this is for the spouse. It is the Cadillac of coverage. It's incredible benefits, and they do use civilian doctors and hospital systems. So my mother-in-law will go to the same hospital that I would if I needed care, except she's going to pay a lot less for it than I am. Tricare for life. Again, this is where I typically get the most questions. This is more, instead of somebody who served in the military and then got out and went and did something else after that. Tricare is for somebody who kind of made a career of the military. They retired from working for the military. So while they're in the military, it's Tricare. And then when somebody reaches Medicare eligibility, it turns into Tricare for life. And so that's what we'll talk about. This is coverage for the retired military member and their spouse. So you'll see typically a husband and wife, maybe they both served and had Tricare on their own. Maybe the wife did, maybe the husband did, but they will both have Tricare for life. It can be used anywhere Medicare is accepted. It acts just like a MedSup Plan F. So if you're familiar with the Plan Fs, you know that somebody goes to the doctor and they don't get any bills from the doctor's visits after that. So this is a group of people that's just like CHAMP VA. They're going to use civilian doctors and hospitals, and they're not really going to have to pay any copays. It does include drug coverage, though, which of course a Plan F wouldn't, but Tricare for Life does. So please feel free to stop me if questions have popped up. Otherwise, I'm going to move on into VA healthcare.
We're looking good, Courtney. You go ahead.
Perfect. Awesome. So I mentioned on the last slide that not everybody who serves gets access to VA benefits. There's three things on this slide that have to be true. They have to be eligible, they have to qualify, and they have to apply. So if you want to take notes, I would write those three things down. Serving in the military is what makes somebody eligible. So obviously there would be no reason for me to apply for VA benefits. I never served in the military. They have to qualify, and we'll talk again. I know I keep teasing future slides, but we're going to talk about what qualifies somebody for VA benefits. It's based on income and disability. And then even if those things are both there, somebody's eligible and they would totally qualify, if they don't apply, they're not getting it. And I can't tell you the number of veterans that I would ask, are you a veteran? We would talk about their service, and I was so convinced that they would apply due to disability or really low income. And they said, oh, I don't get to have VA benefits. And it was really just that they had never applied. And so we were able, in many cases, to get them in touch with their county level or their local veteran service officer to help them go through the application. And then they did find out that they qualified. So agents, you can help tremendously. because it's not a banner that's waved around as come apply for your VA benefits. It's something that they have to take that step to do. And, you know, in a lot of cases they don't. Another thing too that has happened to a few of my own clients is maybe they applied when they first were discharged from the military, and at that time they didn't qualify, but they might now. And so if it's been a little while, go ahead and do it again. When in doubt, fill it out, I think. So, you know, make them tell you no, especially if you have somebody that has a need and might not be able to afford, you know, some of the private doctors and hospitals and things like that. So not everybody's going to get it, but those three things have to be true: eligible, qualify, and apply. Trying to move slides, sorry. Okay. This is, next topic is talking about taking Part B. So when somebody does have VA benefits and they turn 65, a lot of them say, oh, I have VA. I don't need anything else. I'll just have Part A and I won't take Part B. I want you to read the thing on the right. The VA does not recommend veterans cancel or decline coverage in Medicare solely because they are enrolled in VA healthcare. That is from the VA website. So that is not just us saying that. There's a lot of reasons why I'm very motivated to educate people that they should take Part B. And we'll talk more about some of those reasons, but I don't know why we have to have animations on the Medicare card. There we go. So Part B does have a cost. And I know that why pay a cost if I'm just going to go to the VA for everything. The VA doesn't cover everything. And if somebody doesn't take Part B when they're first eligible, when they turn 65, they may have a penalty because VA healthcare is not considered creditable medical coverage. It's a benefit, it's not insurance. So Medicare does not consider VA to be creditable. If they don't take Part B when they're first eligible, they're probably going to have a big old penalty if they do decide to take it later. You know, there are circumstances where that wouldn't be true. Of course, if somebody has Medicaid, they wouldn't have that penalty, but otherwise they would. So they would want to get it when they can. In order for you to consider any Medicare Advantage plan for somebody who has VA benefits, they have to have A and B. So we know that. So if they don't take it when they're first eligible, it may not ever be an option for them. It might end up being cost prohibitive for them to do that, which is one of the good reasons that our honor plans have Part B givebacks, is it can help with that penalty if they do have it, but it's not a cure-all. So definitely don't miss the boat when the option is available. We know, I know, and we know as agents, the incredible benefits that can be in Medicare Advantage plans, the extras, but a lot of our veteran population don't realize that those things are available, and they maybe don't realize that by declining Part B, they're also shutting the door on that potential for them to have those extra benefits. So the bolded thing on that screen is really important. The VA and Medicare do not interfere with each other. They don't coordinate benefits, they don't intersect, they don't interrupt each other. They're like two lanes on a highway. They don't cross paths and don't have any coordination between them. So that's true of Medicare and VA. So they're not going to lose anything from VA benefits by taking Part B or Medicare Advantage. That's a lot there. Any questions that have come in on that?
Courtney, I'm not seeing anything at this moment. No, not yet.
Okay. Now, I did say that there is a penalty if somebody doesn't take Part B as in boy. That, however, is not true for Part D as in drum. So for Part D, VA benefits are considered creditable. So just keep that in mind.
Courtney?
Next topic. Yep.
Okay, we had a question that came in. Question is, veterans have the opportunity for Part B if on disability. Is this correct?
That's right. If the Social Security Administration deems them disabled and they're on disability for the 24 months that's required before they get Medicare, then they would be able to take Part B, even though they're under 65. That's absolutely right.
Okay.
And they could have a Medicare Advantage plan and VA benefits and all of that, even though they're not yet 65. I know I default to saying turning 65, so you're total good call out to say that it could be due to disability as well prior to 65.
Okay. Okay. And the second opportunity is at age 65, is that correct?
That's right. Yeah. Somebody could
Like,
opt to go with Part B, yeah, at 65. Yeah.
oh, okay. Okay. All right. Thank you, Courtney.
Okay. Trying to move slides here. Sometimes it doesn't want to let me do it. Okay. VA priority groups. So something to know when somebody does become eligible and qualify and apply for VA benefits, and once they get them, they are going to be sorted into a priority group. The next couple of slides are really wordy, and you aren't, as agents, expected to remember or know where somebody should be sorted. It's not our job as agents to determine where they fall in the spectrum. I just want you to understand so that you know if somebody says, oh, I pay something or I don't, why that might be. So when somebody gets sorted into a priority group, it doesn't mean that they get seen by the doctor any faster than anybody else. So if I get put in priority group 1, that doesn't mean I have rights to see doctors before somebody in priority group 8. It just impacts how much they pay when they get care at VA facilities. So it is a spectrum and they can fall anywhere on that spectrum. So this is what I mean by it's a wordy slide. You can see all of the different qualifications that would sort somebody into a priority group. And again, I wouldn't even bother with a screenshot of this because you don't have to remember all of this information. It's just important to know that there are a variety of reasons why somebody could be in one priority group or the next. It's usually due to service-connected disability. So let's look at just priority group 1, for example. Oops. So veterans that are rated 50% or more disabled, determined by the VA to be unemployable, would be sorted into priority group 1, and then they wouldn't pay cost share when they go to the VA. So they don't have to pay anything if they're deemed 50% or more disabled or unemployable. So I have a colleague of mine, he's employable certainly, but he was injured during his service enough that he's deemed 100% disabled by the VA, and therefore when he goes to VA facilities, he doesn't pay anything. So I'll show you some costs so you can kind of see some examples of what somebody would pay. And you might hear somebody saying, I don't need a Medicare Advantage plan. I don't pay anything when I go to the VA. And that could absolutely be true. And they're probably sorted into priority group 1. So those who are not sorted into priority group 1, so those, as mentioned, priority group 1 doesn't pay anything. Everybody else will pay based on their income and what group they're sorted into. So that's a really nice feature that it is kind of a sliding scale for people so that it's kind of meeting them where they need to be met. Sorry. Okay, there we go. I'm having trouble clicking slides, so probably my computer's being fussy today. Generally, you can see it is very affordable. Even the lowest priority group, 7 and 8, $15 for a primary care physician and $50 for a specialist. We know that some Medicare Advantage plans might have zero cost share for primary or as low as $25 or something like that for a specialist. So there could be financial reasons somebody might want to go with a plan outside the VA and see a doctor outside of the VA because it may cost less, or it may cost them more, just depending on what options they have. So just so you can see, it is still affordable, even if somebody is not sorted into the first priority group. More examples, I want to show you if somebody has an inpatient hospital stay. So you can see priority group 7 and 8. If the first 90 days of the year, it'll be $311.20 for priority group 7. And then each additional day, after day 90, you can see it's $155.60, and then plus $2 every day. So you can see it is affordable. First 90 days is only $311.20 plus $2 a day. But then once you jump over to priority group 8, that goes up significantly. So that's a pretty big jump in cost between the two priority groups. And if somebody has a predicted hospital stay, like a knee replacement or something like that, you may find that they might have a more financially advantageous experience through a Medicare Advantage plan versus the VA. But again, you can see here, it is a very controlled cost. It's not a percentage without a ceiling. So nice controlled amount for these costs. Let's move on to prescription coverage. So of course the VA does cover medications as well. And I want to show you some of those costs. There we go. So at tier 1, and when we think of tiering, we know that usually the generics are the lowest tier and the brand names are the highest tier, and that's true of MAPD plans and standalone drug plans as well. The list at the VA could be different. So the VA does have a formulary of drugs that are covered by the VA, and that could be more or less expensive than what they could get on a drug plan outside of it. So you can see here, $15 for a 90-day supply for a tier 1 medication. Some MAPD plans might cover that for nothing. $24 for a tier 2 for a 90-day supply, and then $33 for a 90-day supply of a tier 3. Now that is way cheaper than what you might find outside of the VA. Tier 3 meds are usually $47 a month, give or take. So something to keep in mind, some medications may be better filled outside of the VA and some may be better filled within. But this is an important point. So priority group 1, firstly, does not pay for those medications. And 2, any other priority group, if they keep all their medications at the VA, they have a $700 annual cap. So if you move medications outside of the VA, it may end up costing them more because they could get a stopgap if they keep them all at the VA. So keep that in mind. Some people don't pay anything for medications, but those who do are limited to a $700 annual cap. So this is a consideration when you're deciding whether to go with an MA only plan or an MAPD plan for somebody who has VA benefits, because they may or may not want to get their drug coverage outside of the VA. That's why this can be challenging, because everybody is different. Every single veteran you sit down with will have a very individualized scenario that needs to be considered so that you can help them make the best choice. Real trouble with the slide. Sorry, guys. Here we go. Okay. If somebody does go outside of the VA for a doctor visit, can they take that back to the VA to be filled? Typically, yes. However, they don't have to. The VA is not required to write a prescription that was prescribed by a private doctor. They have to agree with that diagnosis. If you go to a private doctor and they say, I want you to take metformin, and you go to the VA and they say you don't need it, they're not going to fill it at the VA. So in order for somebody to get a medication filled by the VA that was prescribed by a non-VA provider, of course, they have to have VA healthcare. That's an obvious one. They've got to have a PCP assigned by the VA. You have to give that VA provider the medical records, so why the diagnosis and why the medication, and they've got to agree in order for the VA to be willing to dispense that medication. So some key points. I had many veterans go with MAPD plans because they didn't want to fiddle around with that piece. Next topic, and this is a big one. This is one of the reasons why I'm so passionate about making sure they really understand, because you can see on the bottom of the screen, ambulance services are not a guarantee to be paid by the VA. Neither are emergency services. So again, this is going to be a wordy slide. The VA may pay for emergency care at a non-VA facility if a non-service connected conditions, if all of the following conditions are met. So you can see there's several lines of text here popping up. All of these things have to be true for the VA to pay for that emergency room visit and that hospital, that ambulance. So you don't, again, have to know all of this. it's important for your members to understand that there could be a case where they would want to have coverage outside of the VA, and this is one of those reasons. Let's take, for example, if a veteran is injured and they're not able to communicate that they are a veteran and they need to go to a VA facility, they're going to just take them to the closest emergency room, even if they are able to communicate. I think legally they have to take them to the closest emergency room. And that could leave them, of course they have Part A, but that could leave them on the hook for the cost of those services. And so it's important for them to know that the VA is not always on the hook for that. Do want to talk a little bit about the Mission Act. So this used to be called the Choice Program. And there are some circumstances, I know I've said that they're totally separate, the civilian doctors and VA totally separate. There are some circumstances where there are allowances made so that people can go outside of the VA. So these are those specific circumstances. This was enacted in June of 2019. So if somebody is having trouble accessing VA doctors because it's either too far or they can't get them in, that would give the ability for the veteran to see a private doctor and hospital. And they're going to want to coordinate that with the VA. So if it's more than a 30-minute drive or longer than 21 days for a primary care mental health visit, they'll help them get that scheduled and pay for it at a private doctor, civilian doctor or hospital. And same with specialists, 60 minutes. So it's a little bit longer of a drive for a specialist, and 28 days. There are also urgent care facilities. So we know people need care faster sometimes and they don't necessarily want to go to the emergency room. So there is a contracted network of urgent care facilities that you can find on the VA's website. So va.gov, you can find that information there, and that way you can educate which facilities around your veterans are part of that contracted network of urgent care facilities. And there's a lot of them. So it usually isn't too hard to find somewhere they can go in a pinch if they can't get to a VA and they don't want to go to the emergency room. I hate going to urgent care facilities, but darn it, they're needed sometimes. Okay, I'm gonna kind of wrap up the VA healthcare section. So we talked a lot about all of the positives of the VA. There's a lot of good to it. The VA is going to understand better than maybe others what these veterans have been through, what their unique needs are, what they're going to need for their care, maybe more than somebody outside of the VA. It's going to help people who need it the most. As we mentioned, it's based on their service-connected disability and their financial status. And it's going to be there for the people who need it the most. And we saw that it is affordable, and you can stack the coverage with other things based on what your member needs. If you've got somebody who just wants to use the MA plan for the gym membership, they absolutely can. If they're going to go get to the VA for everything, they have every right to do that. There are a couple of downsides, of course, to VA healthcare. We saw that not everybody gets it. Maybe some people probably really could use it, but they don't qualify, or they're not eligible. So not everybody's going to have access to VA healthcare. The facilities, can be a little bit of a jaunt. My uncle had cancer, and so he had to travel to and from Iowa City several times a week for his chemotherapy treatments. And he did not take Part B when he turned 65, so he really couldn't get it later so that he could go do that closer. So family had to drive him multiple times a week up there to go get chemotherapy treatments. And that can be a real challenge. Not everybody has family that are able to do that for someone. Many physicians choose to work for private doctors and hospitals rather than the VA. I have an example of this. We have in one of the parts of my area, there's a cardiac doctor who's apparently just the bee's knees. He's the top of the line cardiac doctor, but he doesn't work for the VA. So I have several veterans in that area who take plans outside of the VA so that they can go see that really amazing guy. So that's just an example. Mayo Clinic, another example. A lot of people would want to go get care there. That's not a VA facility. So we hear all the time that people want to use the VA. Well, they can on the honor plans because it's in the PPO network, at least the one in Minnesota. If you're not in the Midwest, or if you're in Florida and Arizona, they don't accept Medicare patients. Any questions on VA healthcare?
Nothing that I've seen. No, not yet.
Okay. I'm going to linger here on this slide for just a moment, just in case anybody wants to jot it down. I mentioned that helping veterans apply for VA benefits is a really good way to help them. This is how you do it. So make sure they have those phone numbers, those forms that they would need to apply. We don't have to be the expert on applying or whether somebody qualifies. We just have to help them get to the right place. Next topic I want to talk about is, I kind of talked about a lot of this, so kind of duplicating myself here. Why Medicare Advantage? I'd be remiss if I didn't say that I think that people with VA healthcare have just such a tremendous opportunity to gain extra benefits. So we talked about, non-VA emergency services may or may not be covered. We talked about the prescription formulary, maybe a drug they really think they could take or a doctor recommends isn't covered by the VA. They could get that coverage outside of the VA. Something I haven't mentioned yet is second opinions. So something that is true for most VA experiences is people can't get a second opinion. Once there's a diagnosis, they're not going to contradict themselves. So a lot of times it can be difficult to get another set of eyes on a diagnosis. You can absolutely get second opinions outside of the VA as much as you want. That's a huge reason that people do make sure that they have A and B when they're 65, so that they can see doctors outside of the VA, and Medicare Advantage can be really helpful there. I discussed some cost saving opportunity, but really the plan extras are just so amazing. In my area, we have plans with $100 Part B give back. So it reduces the cost of their Part B by as much as $100 or sometimes more in some spots. One of our plans has $4,000 in dental. So there can just be such incredible extra benefits. And the VA typically isn't going to cover dental, vision, or hearing unless it's service connected. In some circumstances maybe, but if you want to guarantee those benefits, Medicare Advantage is where it's at. So we know that there's so many great extra things involved in MA plans that just aren't available through the VA. If somebody's low income, they can even get the healthy options card and pay for food and things like that. So got to take Part B when first eligible to be able to do those things. Every carrier really has nowadays a solution for veterans. They're the MA only plans now go by different names. Humana's is the Humana Honor. We've been doing this for a long time, and these plans all kind of fit the same bones. They have zero premiums with a Part B give back. Most of them are PPO plans that have national networks and tons of stellar doctors and hospital systems, dental coverage, vision, hearing, over-the-counter benefits, Go 365, silver sneakers, and so on and so on. So that is what Humana calls our MA only plans, and they are endorsed by the USAA. You'll see that branding on the sales kits, which does help members to feel a little more confident when making that decision.
Hey, Courtney, we had a question that came in. As far as children, I'll just kind of read it, the question. Do the children have coverage through CHAMP VA or another source of veterans with service connected to disability?
It's supposed to be for the spouse and the family. Great question. Let me get that back for you.
Okay, yeah, if you want to get back to me and then I'll get it with the agent.
Yeah, I mean, it is for the child too. My experience is much more, when somebody is over 65, because my husband's an adult, so he's not considered a child in that scenario, but it is for the spouse or a child of a veteran with his disability or died as a result of their service. So yes, the children can be part of that as well. I'm more speaking about it from the perspective of once somebody who has a service-connected, spouse pass, or they would have Medicare, and their children would then, probably be older. So I'm more focused on the senior population for this conversation, but I will get you more detail on that. I'll send that over to you, Arlen, so you can get that out.
Okay, Wonderful, thank you.
Okay, there is a special election window. So this is another key piece to know. So take some notes here. There is an opportunity if you sit down with somebody and they say, yes, I'm a veteran, I do have VA benefits, CHAMP or Tricare, and I'm currently enrolled in either an MAPD or a standalone drug plan, PDP. They can always, any time of year, get out of that private drug coverage and into an MA only, if that is what's best for them. So I'll tell you a scenario. I was in northwestern Iowa. It was late in the afternoon, and I was going to help a wife of a veteran with her MAPD plan. And during the conversation, we uncovered that her veteran husband had a med sup and a PDP, because the last agent who came, didn't know to ask the questions, and so they just went with what they always did and wrote him a med sup, plan F, and a PDP. And this guy wasn't using those at all. He was wasting hundreds of dollars a month on plans that he never ever used. So I was able to move him right away to an MA only plan, get him out of the SUP, get him out of the PDP that he wasn't using, and into an MA only. So both things on the screen have to be true. They have to have VA benefits and they have to have private drug coverage. It's not just a blanket SEP for anybody who has VA benefits. So keep that in mind if you're going to use this. It's got to be that they don't need the drug coverage that they have through the private company, whether they're on our Walmart drug plan or an MAPD. If they don't use that, then you can get them out of it. Now, if they're using it, by all means, leave them as is. But that is there for you if you bump into that situation, which I certainly have. Next topic, Tricare for life. So this is, again, where I get the most questions, Tricare for life. This is, again, like the Cadillac of coverage. It's a premium-free. Medicare pays first, Tricare for life pays second. They have to have A and B, so this is not an option. They can't decide whether or not to take Part B. If they have Tricare, they got to take it. They got to have B because Part B has to pay first. We do get a lot of questions from Tricare beneficiaries because of the extras on, hey, can I take a Medicare Advantage plan? You'll hear Humana say, sweeping statement. If you don't know what you're doing here, leave them alone. It's best to leave somebody with Tricare alone because there could be things that can get messed up, and we're going to talk about it. So I'm not going to leave you alone there. So firstly, let's talk about the advantages of Tricare for life, which we kind of already have. It's like a med sup plan F. Members don't pay a premium. There's no networks anywhere that takes Medicare, takes Tricare, no referrals, no copays. There's drug coverage and it costs nothing. So it's incredible, incredible coverage. You see that line at the top that says $3,000 MOOP. That only applies to a very select number of services that aren't covered by Medicare. It's like a purple unicorn. Like, it just doesn't happen very often, but it's there in case that those services are needed. It's like foreign travel or something like that, but it's very infrequently used. So that's the purple unicorn. Now, if you've got somebody with all of those advantages on the left, and they're like, hey, can you sell something else to me? You can, but you need to know this. Firstly, an MA plan could create a network where they didn't have one before. So I would never do an HMO for somebody with Tricare for life. PPOs, the plan will still pay first, and then Tricare should pay second. So that could still work, but it's going to probably create some headaches. And just because a PPO will pay out of network doesn't mean the doctor will take them as a patient. And we've had that come up, and I had an agent get an allegation, a complaint to Medicare because of it. So just know if their doctor's not in the network, don't do it. You don't need to. They're fine as is. I mentioned referral, and don't do an HMO. Referrals are required on some HMOs, most not anymore these days, but if it is a requirement, then that just creates a layer of headache that they didn't have before. The MA plan could have a premium. Now, most don't, but there's no reason to add a premium for somebody with Tricare, so I wouldn't do that either. The most important piece, and the one that creates kind of the most questions, is the claims. So it's important to know when somebody goes to the doctor, they go to a civilian doctor. So I'm going to go to my primary care physician down the road here, and the bill will first go to Medicare, and then that automatically gets kicked right over to Tricare. Member never sees a bill. It just seamless process. Billing works great. If you put a Medicare Advantage plan in place of original Medicare, that claims process is interrupted. So my primary care physician will bill the Medicare Advantage plan, and they've got to know to then bill Tricare, or the bill's coming to me, the member. And that's not a great experience. If they've never gotten a bill before and suddenly they are, and they didn't know that that could happen, they are going to be very upset. And we've had several, again, complaints to Medicare because people think they owe those bills. Now they don't. The bill still needs to go to Tricare, and there is a Tricare claim form that members can fill out and get it paid. But now they're involving themselves in a claims process that they didn't have before. Some people are perfectly fine with that. They want the extra benefits. They don't mind at all. They don't mind maybe getting in the weeds. They can also call up the doctor and say, hey, doc, you forgot to bill Tricare. And the doctor will usually take care of it. Maybe the doctor won't, or doesn't know to, or can't, whatever the case may be. Then the member might get a bill. So just prepare them for that. If you ever get a bill in the mail, give me a call and we'll make sure that we do what we need to do. So if you're going to sell somebody an MA plan who has Tricare, I would ask that you be involved in that service part of the things on the back end, because otherwise then, you know, a member might get a bill and they might actually go ahead and pay it out of pocket when they don't need to, and that shouldn't happen. So questions coming in on that. Did I explain that well enough? Should I elaborate further?
No, you're good. You can proceed.
Okay. So bottom line for Tricare, you can do it. Just make sure that they show their MA card and tell them, I have Tricare. Make sure you bill Tricare at every doctor appointment, every time. Champ VA, you're going to find, works very similarly. So again, this is health and drug coverage. If the veteran has been rated permanently and totally disabled to a service-connected disability, or they died as a result of their service. And this, again, my mother-in-law has Champ VA. When she turned 65, we actually got into an argument. I'll share this with you. We got into a little bit of disagreement because she thought, hey, I'm 65. I'm going to go buy the same plan that everybody else around me has. I'm going to go buy a med sub. And I was like, don't do that. You'll qualify for Champ VA because your husband passed due to his service. And it took some doing, but thankfully she listened. I had to get a little noisy about it. I'm like, you're not hearing me, trust me. And she applied, and now she doesn't pay a thing when she goes to the doctor, and she doesn't pay a premium for a med sup either. And so you're gonna find that people don't know that this is available to them, especially if their spouse passed a long time ago, which is the case for her. He died, gosh, 25 years ago, more than that now. And so she just didn't know and believed, you know, her friends around her, and that would have been such a costly thing for her not to apply. I wish it was automatic, but it's not. So they have to take that action. A little personal story there. Left side of the house, the upside to Champ VA. It looks just like the Tricare for Life. Med Sup, Medicare pays first, Champ VA pays everything else, no premiums, no networks, no copays, and it does have drug coverage built in. But the right side does not look the same. Of course, there's a couple similarities. The plan could create a network, but importantly, even if on a PPO, Champ VA is not paying out-of-network costs. So if they go outside of the PPO network, Champ VA is not picking up that cost most of the time. So they've got to stay in the network. They cannot, don't do an HMO, of course, but if you got out-of-network doctors on that PPO, I wouldn't do it either. Never PDP or an MAPD for somebody with Champ VA. It will cancel their meds by mail option. Now, I do have a few people who didn't like their meds by mail. They didn't care for the coverage of that, so they did want coverage outside, and that was a choice they made knowingly. But if somebody's not specifically saying that, don't do it. MA only, always. Champ VA secondary to the Medicare Advantage plan, just like Tricare for Life. So that same claims processing thing will happen here too. So they just have to make sure they're saying, I have this Medicare Advantage plan and I have Champ VA. Make sure you bill both, and it should work. But again, there is a Champ VA claim form if they do get a bill in the mail. So just prepare them. If you ever get a bill, give me a call or use this form. Very, very similar things too. So can't VA, MA only would be your only option. And just make sure they very much understand that that claims process could get muddier. Any questions on those? Did anything come in?
I don't have anything now.
Okay. Well, that's great. I'm glad that everybody's feeling good. I usually do get a ton of questions about both of those things, but that's great. So let us know, of course, if you have questions after the fact. We can always circle back. But I want to talk about a couple things. We like to capture veteran status. I mentioned it at the top that it will show in your enrollment hub or in your book of business who is a veteran. It's really important. So make sure that you're putting that in whatever application process you're using, whether it's paper or enrollment hub or wherever. We'd love to know who our veterans are. You can do it in Fast app as well. I already mentioned why it's important, so I won't linger there. I'll linger here for just a minute. So we do have a veteran engagement guide and an FAQ doc that I'll make sure, Arlen, that you have so that we can get that out. There's just so many different ways to get resources for this population. There's so many different programs. You can see some of the national partnerships that we have, like the EBV. If somebody is an entrepreneur, we donated $1 million to help the EBV to help veterans start their own businesses. You know, there's just so many things out there. So we'll make sure that you have access to all of that. If you have Tricare questions, you can see tricare.mil's website is right here. You know, the VA Mission Act, all of those things are available here if you want to do some researching on the backside. There's also that form about the SEP I mentioned. So it kind of goes into it in more detail so that you have it. I know sometimes that all the different options for different special election windows can be really confusing, and there's a lot of them out there. So we have everything in writing, of course. I mentioned the FAQ doc. We'll get that out to you guys too. And then for those of you who really do want to engage in this space, it's an incredible way to give back. We have tons of resources that can assist. So education is always my favorite place to start. If you have a relationship with an American Legion, you can do a veteran-focused Medicare 101, and we have that presentation ready to go. It's sitting in the Marketing Resource Center right now. There's also pamphlets you can hand out, and all of the enrollment books. Everything is branded for veterans, so they're going to know that you're talking to them specifically. So we've got all of that material available all the time. And that's what I have for you. I'm going to kick it back over to you, Arlen, and you, if there's any questions, happy to answer, but otherwise I'm all set.
Okay, thank you, Courtney. At this time, it doesn't look like there's any more questions. So if you do happen to have a question after this afternoon, feel free to give us a call at 800-228-0008. Ask for a senior health specialist. We have Joanne, Colin, and myself, Arlen, in the senior health. And if you're interested in getting, some agents are not appointed with Humana, and so we can help you get appointed and licensed with Humana. So that's everything we have today, and I hope you have a good rest of your day. Thanks so much.
Thanks, everyone.